Hi, my name is Elena Rambo. This presentation is for the first assignment um, in the nursing class FlexPath 4010, and it's about collaboration and leadership reflection. The class is about leading people, processes, and organizations in interprofessional practice at Capella University. Interprofessional collaboration in healthcare is essential for patient safety and providing a high quality of care. Poor communication between healthcare professionals will lead to errors that will threaten patient safety. There is a need for interprofessional training to improve patient-centered care. Morgan, 2019. Collaboration in the healthcare field is defined as the ability of each healthcare professional to capably grasp complementary roles within a team, work together, share the duties for problem solving, and make the needed decisions to develop and carry out plans for patient care. Studies show that interprofessional collaboration between physicians, nurses, and other healthcare members increases the collective awareness of each other's insight and skills, increasing the quality of care through improved decision making. Busari et al., 2017. In this presentation, I will bring up the issue of poor intraprofessional collaboration that leads to inefficient management of human and financial resources, the best practices of leadership strategies, and the best practice collaboration strategies to help a team achieve goals. I'll back it all up with peer-reviewed literature that is not older than 5 years. Reflecting on the Villa Healthcare, I observed that it is a lack of communication between management, team, and IT regarding the implementation of the new computer system. This creates stress and puts the patients at risk. I work on a busy telemetry floor. Every day we get to interact with different professionals involved in the care of our patients, starting with the physicians, respiratory technicians, physical therapists, occupational therapists, speech therapists, and nursing assistants, dietitians, and housekeeping. For the best care of the patient, it is important that the team collaborates well. If there is miscommunication, patient safety is in danger, and the hospital can incur unexpected costs, and the patient's recovery may be prolonged. That is why the leadership must assure that the care providers have a path of communication that is efficient. In my hospital, as a nurse, we communicate with the physicians during rounds, but also through a computer program called Perfect Serve Care Team. Through this program, we can get the physician's attention and we can get a hold of them. The program allows to send routine questions, but also has an urgent option if needed. We're very thankful to have this tool, but it's not foolproof. There are physicians that are not adherent to this tool, making patient care difficult. The management needs to address this issue by communicating to those physicians that the lack of collaboration creates a higher risk of errors and the quality of patient care is not optimal. Busari et al., 2017. Another problem is poor communication between hospital units. A recent incident comes to mind. I had a patient transfer from the emergency department, admitted for weakness and falls. They sent her to my floor and did not report that she had a history of seizures. When we got the patient on the telemetry floor, we immediately put a cardiac monitor, but nobody knew that she arrived. Eventually, a nursing assistant let me know that my new patient's on the floor and not responding to verbal stimuli. I quickly went to her room and tried to wake her up. After giving her a chest rub, she opened her eyes, but she couldn't answer any of my questions. I called the operator and announced a medical response code. The neurologist, physician assistant, Charge nurse, nursing supervisors, and two nursing assistants came immediately. After hooking her up to the telemetry monitor, we observed that her heart rate was high. The neurologist thought that she had seizures and put her on Capella. Because of her acuity, the co-team decided that she needed to be transferred to ICU. The lack of communication delayed this patient care and possibly lengthened her recovery and cost of care. On the telemetry floor, when we have unsafe incidents for the staff or the patient, we must report them to a site called Safety First. The leadership reads those complaints and decides how to solve the safety issue. Later in the week, we had a staff meeting involving the workers that were involved in this case. The emergency department nurse ignored the history of the patient and the gravity of her state. She said that they were short-staffed and just wanted to move patients from the emergency department holding to the floor because the waiting room was packed and they needed to triage people there. The transporter who brought the patient on the telemetry floor without informing anyone of her arrival stated that he didn't know that he was supposed to report that. Communication failures during the transition of care have the potential of causing harm to patients directly, causing delays in treatment and inappropriate care. Morgan, 2019. Shifting the blame is not part of solving a problem. The leadership listened to us and pointed what was done right and what needed improvement in this case. The lack of staff is a significant safety issue contributing to many mistakes. Also, interprofessional communication shows a need for improvement. The management proposed that a transporter must report to the nurse that takes over the patient. The transporter did not agree to this idea because they're often rushed up and it's hard to find a certain nurse on a busy floor. The nurse proposed that the transporter at least can inform the charge nurse or the clerk, usually at the nursing station. Everyone agreed that this was a better solution. The telemetry nurse also mentioned that the emergency department often sends unstable patients on the telemetry floor instead of the intensive care or progressive care unit, which resulted in codes that were not manageable on our unit. The management proposed a better determination of patients that cannot go on the telemetry floor, such as those needing cardiac drips and stroke patients who can be treated in progressive care or intensive care units. In this case, the website Safety First provided an essential source of getting the root of the problem. All employees of our hospital have the chance to report incidents that are deemed unsafe for patients and the staff. The nursing supervisor brought this incident to the hospital CEO, who decided that all staff must be kept up to date on education regarding reporting incidents to improve working conditions and the level of patient care. In this case, the incident brought up an opportunity for improving communication and collaboration between the members of the care team. The coordination and delivery of safe, high-quality care demands reliable teamwork and collaboration within, as well as across organizational, disciplinary, technical, and cultural boundaries. Rosen et al., 2018. Thank you for watching this video.